Thank you, ma'am. So, this is about managing diabetes at school and other settings. So, why we should think about school is there's a lot of stigma associated with diabetes in school, because over the time there is a lot of bullying happening in the schools. We know about that. And when a child is diagnosed with diabetes, we all teach them that you should tell everyone, at least the class teacher and your classmates, the bus driver, everyone, that you are having diabetes. Because in case of hypoglycemia, those who are nearby is the one who should help. But it's a very, very difficult task to perform. So there are mothers who just stop sending their children to school. There are children who just tell that I am not going to take insulins at school. So because when we were students, we were taught that insulins can be taken 2 times a day for type 1 diabetes, and none of them never had any good control. And only after we started this basal bolus regimen, children started having better control. So it is so important that they should take insulin at school. So removing stigma is the most important thing. And how can we remove stigma? That is by educating everyone actually. It is not educating a particular person or a particular school teacher. One important message which should go to the society is type 1 diabetes is different from type 2 diabetes. It is not a disease of lifestyle. It is not a disease which is invited by our own actions, because if we get type 2 diabetes, there is a reason for us to feel some shame, because it is also related to our lifestyle. But for the poor kid, it is not. So that message should be very clear and should go into it. And the most important thing, a child spends most of their waking hours at school. So if you are not managing diabetes at school, then diabetes management is not going to happen. So there should be a safety umbrella, and that umbrella should have at one end the healthcare team. The responsibility lies with us. We have to actually connect with the school team through the parents. That's a very, very important thing. It is not that the parent is going to the school and telling that my child is having diabetes or something like that. We should write in black and white to the principal or headmaster, who is the head of the institution, and tell them that these are the things the child will need during the school time, and very clearly state that there are no restrictions for the child in taking part in any competitive examination or extracurricular activities. That also should be there, because most of the time the child will be labeled as Sugoillatha Kutti, and he will be kept out of all the activities from the school. So that also should be very clearly explained. And the school team doesn't mean only the teacher. It should also include the person who is sitting in the canteen, the driver and the conductor who is managing the school bus, and the ayah who is taking care of the child. All those things should be taken care of. Again, you should remember that if there is no optimal control of diabetes, if the child is getting repeated hypoglycemias and hyperglycemias, what is going to get affected? The child's memory and the learning capacities. So for optimal learning, we need proper control of diabetes, and it also is needed for the prevention of complications in the child. And it's almost more than 30 hours in a week the child is spending at school. So diabetes management is of paramount importance at school. And type 1 diabetes is not a life-limiting disease anymore, because there are many people. Can you identify any of these people who are there? At least the girl with the Indu Thambil, he is a film actor, and actually both of them are type 1 diabetes ambassadors. The other one is Jas Sethi. She runs a YouTube for it is called Diabetes. good. And now there is a man who is type 1 diabetes and living after 90, and there are so many people who are doing very well, exceptionally well, not like us. So being type 1 diabetes is not a limiting disease. So that is why we need to make our children live their life fully. But nothing in this world comes without a price, or whatever you need to achieve, you have to do something. So lot many things are involved. You have to help the child, take the insulin properly, monitor, exercise, everything should be done properly. And now the concept is not hemoglobin A1C. We need the sugars to be in the normal range, that is between 80 and what is the cutoff they say? The time in range? 80 to 180. So that should be there for at least 70% of the time. So if someone is staying at the school for most of its waking hours and you are not going to manage at school, then it is not going to happen. So that is very important. And there should be an individualized diabetes plan. Why I am telling about individualized diabetes plan? It will be different for each child. Sometimes a small child can manage by himself or herself. A 8-year-old child will take all the injections, everything. But sometimes a 13-year-old adolescent may need the help of the mother. So we should allow them. It is not like you are going to allow the mother for a smaller kid and not for an adolescent. So it should be an individual care. And the insulin which you are deciding should be given at school. It's not something which is prescribed by the school. So the timing is also important. So that's it. So the SPAD 2022 guideline had put forward the important components of care in school. That means there should be a policy which should be done by the state. Actually it should come from the national level, then the state, then the school, and that should be implemented. And there should be provision for supervision and care of these children. There should be facility for insulin storage, place for injection, and we should provide ample opportunities for glucose monitoring also, be it a glucometer or a CGM. And there should be, I told you, there should be a place for diabetic care, and we should decide between individualized care, that is whether the child can care self or parental support is needed, and the child should be participating in physical activities with the supervision and ensure that there is no stigmatization. And legal support is also important. Actually, WHO and many countries recognize type 1 diabetes as a disability, not yet in our country. I think there are many pending work is going on in the national level itself, in the courts, in the ministry, everywhere. But there have been a lot of changes which has happened, especially in Kerala, because of the efforts of the parent groups and type 1 diabetes communities. So these are a few of them. One is now children can avail extra time for examinations in schools as well as colleges actually. So we need to just produce a certificate. And initially it was very difficult for the children to carry snacks and glucometer to the examination hall and all, but now it is allowed. Even for the most stringent NEET examination, now they allow children to carry all this. So that is important. Then there is a recent circular from the Director General of Education that the school should provide a safe, private and convenient place for insulin shots. So gone are the days when children take their shots in the bathroom. It is not like that. There should be a room for these children. So this parents can demand, because as people who are taking care of children with diabetes, we should know all this so that we can empower our parents to ask the school for all this, because it is already there with the government. So, and if there is a problem at school, it is the school's responsibility to arrange a referral and transport to the nearby healthcare facility, and awareness classes for teachers on type 1 diabetes during their annual in-service training program has to be done. So this all has come in. And now there is an order which tells that there can be, priority can be given to parents of type 1 diabetes children, and even people living with the type 1 diabetes when the government is considering transfers and postings. And in the same this thing, the government, not only the government, the Indian Society for Pediatric and Adolescent Diabetes is also conducting regular classes for school teachers in the Zoom platform and all. So we should be aware of such efforts also. Then regarding exercise in the school or outside, it is told that there should be at least 60 minutes of moderate to vigorous intensity physical activity every day. And when we are choosing the physical activity, it is also important there should be some amount of resistance training, there should be some amount of bone strengthening exercises also, because diabetes is one disease which can also affect your bone mineralization. So that is very, very important. And so resistance training at least 3 days a week, and regular physical exercise every day is what is recommended for children with diabetes. And during all forms of physical exercise, high glycemic index carbohydrate should be available. That is, there should be some snack which is available, which may have to take before the exercise or during the exercise, depending upon the intensity of the exercise. And self-monitoring of blood glucose, either by a glucometer or a CGM, are essential for optimizing time in range and preventing hypoglycemia during and after exercise in all children and adolescents with diabetes. And remember, when a child has done some unaccustomed exercise, there is a chance the child will develop hypoglycemia not only during the exercise. The child can develop hypoglycemia even hours after exercise or during sleep on that particular day. So in such instances, we should actually warn the parents, and there should be a more stringent screening for hypoglycemia during such days. And always remember, CGM lags during prolonged aerobic exercise. So in such conditions, if you are doing a prolonged exercise, don't rely only on the CGM. You may have to do some finger stick examination also. Then insulin adjustment and nutrition strategies can be combined to keep the glucose level in the exercise range of 90 to 270. That is what is the recommended blood sugar level which we should keep during exercise, whatever be it, and which can prevent exercise-induced hypoglycemia as well as hyperglycemia. And insulin should be administered in areas not actively engaged in muscle contraction. So mostly we will be choosing the abdomen during such episodes. An episode of severe hypoglycemia or recurrent antecedent hypoglycemia within the previous 24 hours is a temporary contraindication for physical activity. Or hyperglycemia with concomitant ketonemia or ketonuria, or when there is infection or acute injury, you have to postpone the the exercise. So these are the listed effects of exercise in diabetes. It is not like see, when you look at the hemoglobin A1C, from 0.2 to 0.5% decrease in hemoglobin A1C means that is some sort of intervention. It is as important as you are changing the dose of insulin, and it actually prevents the mortality, it enhances the muscle mass and strength. So all these things are known, but after knowing all these, we should all think how many of our children and adolescents with diabetics are doing, and forget the others, because they may not do, but how much we are able to motivate our children to do this is something we should all ponder about. And what about joining the SPC, NCC, Scouts, etc.? They can join. So among these, there is one type 1 diabetic kid. You are not going to identify who it is, and he is doing extremely well. Okay, so actually when this particular child enrolled for the SPC, the teacher just told, you cannot join. Then he went to the principal also told him, you cannot join. Then we wrote a series of letters. We threatened them that we will go to the the child rights committee and all. Then only he got enrolled. and he is very happy. So we have to empower them. We have to empower them, and once they asked us to give a letter that if there is some untoward incident occurring, they are not responsible. The healthcare team is responsible. I told, okay, so we are responsible. The only thing is we need to teach them. When he is going for a parade or something, when he is going for some camping or something, you should support them. You should be teaching them how to do the extra things. And what about hiking? Always children, most of our children with diabetes, the parents are afraid of sending them to even for a single day tour. Even if you are telling that the child is going to come back in the evening, before the night, then also the parents won't allow them to go. So the best way to remove the stigma is take them along with you for at least one day. We do it regularly. We take children to the museum or somewhere near, and we allow parents also to come along. Then they will identify this okay. And if we can do a night camping with them, then people will be, the parents will be more comfortable. So how it is happening? Because see, as children, they owe all this. We should not take away the childhood from them. We are actually giving lot many injections. We are doing lot many finger the pricks and pain and everything, all those restrictions and all. And if you are not allowing them to enjoy at least some time with their friends, it is not right. So we can empower them. So the things which we should tell them regarding traveling. So if they are going for a 2 or 3 days traveling, you should always ask them to take everything with you. Like insulins, they may have to take some extra doses of insulin. They may have to, someone is on pen, but ask them to take a vial of insulin and syringe also, because if the pen is not working, you need a backup. If someone is on pump, you ask them to take the pen also along with them, like that. So extra things you can carry, and teach them about how to carry these things, because there are some restrictions when you are traveling in a flight and all. So you can actually take the insulins in your hand baggage. So if you have a prescription, insulins you can take in your hand baggage, pump you can take in your hand baggage. Pumps are usually disconnected while traveling in a flight. Why? Because there can be some pressure variations and the delivery can alter. So during the flight you just disconnect the pump, and once the flight is over you can reconnect. So like that you can explain to them. And the glucometer and sometimes pumps may get damaged by the X-ray of the airport. So that way if you can explain to them and give a letter, that will help. Insulins can go through the X-ray, nothing is going to happen. Okay. So it's like this was one camp which we conducted, and actually it was an eye opener for us also, because during the whole night nobody was sleeping. They were all playing, and many of them developed hypoglycemia because of the unaccustomed exercise. And they treated themselves, and everything went fine. The only thing is we need some amount of supervision. And only after this camp, and only because of this camp, the parents allowed them to go to the class tour and all during the next year. So we can make changes if we try to. So we should allow them to say. So all these experiences I gained only because of the diabetic clinic which we have SAT, and there are many people who had helped in doing all this. Thank you.